Signs of HIV in men after 2 months. Hello, viewers. I'm Dr. Mark, an infectious disease specialist with good experience treating HIV/AIDS clients. Today, we're going to discuss a critical topic: the signs of HIV in men approximately 2 months after infection. As a physician who has treated numerous HIV cases, I want to share some important information with you. Before we dive in, I want to emphasize that HIV symptoms can vary greatly from person to person. Some individuals may experience noticeable symptoms, while others may not show any signs at all. This is why regular testing is crucial, especially if you've been potentially exposed to the virus. Let's consider a scenario to illustrate what someone might experience. Meet Tom, a 28-year-old man who had a potential exposure to HIV about 2 months ago. He's been feeling off lately and decided to schedule an appointment with his doctor. As we go through Tom's case, keep in mind that his experience is just one possibility among many. Common symptoms at the 2-month mark. 1. Flu-like symptoms. Tom has been experiencing persistent flu-like symptoms for several weeks. He's had a low-grade fever, fatigue, and body aches. These symptoms are common in the acute stage of HIV infection, which typically occurs 2 to 4 weeks after exposure and can last for several weeks. 2. Swollen lymph nodes. During his physical exam, Tom's doctor notices swollen lymph nodes in his neck and armpits. This is a common sign as the body's immune system responds to the virus. 3. Skin rashes. Tom mentions a rash that appeared on his chest and back about a week ago. It's not itchy but looks like small red bumps. Skin issues are often reported in early HIV infection. 4. Night sweats. For the past few weeks, Tom has been waking up with his sheets damp from sweat, even though his room isn't particularly warm. Night sweats are another common symptom of early HIV infection. 5. Unexplained weight loss. Despite not changing his diet or exercise routine, Tom has lost about 5 pounds in the last month. Unintentional weight loss can be a sign of HIV affecting the body's metabolism. 6. Oral thrush. Tom's doctor notices white patches in his mouth, indicating oral thrush. This fungal infection can occur as HIV begins to weaken the immune system. It's important to note that while Tom is experiencing these symptoms, they aren't definitive proof of HIV infection. Many of these symptoms can be caused by other conditions. However, given Tom's potential exposure and the combination of symptoms, his doctor recommends immediate HIV testing. The importance of testing. If you're experiencing similar symptoms or have had a potential exposure, it's crucial to get tested. The CDC recommends that everyone between the ages of 13 and 64 get tested for HIV at least once as part of routine healthcare. Those at higher risk should get tested more frequently. Modern HIV tests can detect the virus as early as 10 days after infection, although it's generally recommended to test 3 months after potential exposure for the most accurate results. If you test negative but are still within the 3-month window, your doctor may recommend retesting to be certain. Living with HIV. If you do test positive for HIV, remember that with today's medical advancements, HIV is a manageable chronic condition. Early diagnosis and treatment can help you lead a long, healthy life and prevent transmission to others. Antiretroviral therapy, or ART, can reduce the amount of virus in your body to undetectable levels, which means you can't transmit the virus to sexual partners. This concept is known as U equals U, where undetectable equals untransmittable. Conclusion: understanding the early signs of HIV infection is crucial for timely diagnosis and treatment. However, remember that symptoms can vary widely, and the only way to know for sure is to get tested. If you're concerned about HIV, don't hesitate to speak with your healthcare provider. They can provide testing, counseling, and, if necessary, start you on treatment.